welcome back, Georgina. Well, it's cold and flu season, whether we want to admit it or not. Are we managing our sniffles? Do we know how to manage our sniffles? Well, our next guest, Dr. Paul Saad, is here to share with us just how we need to be doing that. So welcome to the show.
Thank you for having me.
Introduce yourself and tell us about the clinic.
Absolutely. So I'm a family doctor. I've been in Georgina for about 10 years now. I started in Keswick, and then we opened up our space in Sutton on Dalton Road about a year ago now, in February 2023. We're very excited about the clinic, and we're trying to do a little bit more than just typical family practice. We're trying to offer sort of a one-stop shop sort of in the clinic.
Which is what you need in a smaller community.
Absolutely. I think it's very convenient for our patients, and, and everybody seems to really appreciate it, so we're very happy about that. We have about 10 exam rooms, and so the goal is eventually to have lots of practitioners working together between family medicine and nurse practitioners and everything like that. We do have a walk-in clinic, which is open Monday through Friday right now. All the hours are on the website. We just opened up, we're really excited about this, we opened up a cardiology suite with a stress test machine, echocardiogram, EKG, all this sort of equipment to do full cardiac testing.
Yes.
And we lease the space out, or sublease the space out to a company called Cardio Health, which has just been wonderful. Fast turnaround time for the testing.
And that's important when you're talking cardio.
Absolutely.
And, hello, I've done that stress test and that whole thing.
Absolutely.
Yes.
And so they're very, very responsive and great about their services as well. We just opened up a blood lab last week, which is really nice. So we can offer in-house lab services. So come see the doctor, get your blood test on the way out, which is really nice. We have a foot care nurse, which comes about once a week, and she does some work mostly with older patients, with more of our senior patients doing foot care and things like that, which is just wonderful as well. And we have a small respiratory clinic that comes in once a month to do some spirometry and lung testing. And so we're trying to offer lots of different services. And what we just added, which we're also really excited about, is a cosmetic component too. So we're doing Botox, not just for cosmetic, but also for medical. TMJs, migraines, things like that.
You had me a Botox, Dr. Saad.
So yeah, it's kind of nice having all the services together. We like it.
Who'd have thought? Botox in Sutton.
Who'd have thought?
Yeah, it's pretty nice.
But what about this cold and flu season? Because, you know, people are always saying, should I get the flu shot? Should I not get the flu shot? And how do we manage this? Well, you just woke up with it.
Yeah, I did, just out of the clear blue, 7 o'clock last night. I know, because E.T. was on.
Yeah, absolutely. I mean, I think the important thing is to realize when it's something that needs to see a doctor versus something that we can kind of deal with at home.
Yeah.
You know, chicken soup and the whole sort of supportive care type thing. So I think that especially for kids, you know, if it's just sort of a sniffle and a little bit of a cough, but there's no fever, they're still eating well, they still look pretty comfortable. Usually it's the kind of thing that you can manage at home for the first few days, 3, 4, 5 days. And then if it progresses to get worse is then when we'd love to see you. So a fever, things like that. One of the big questions that I get a lot in the clinic is what's the difference between, for example, a cold and strep throat, for example.
Yes.
And so the main symptoms of strep throat are there is no cough usually, believe it or not. And that's one of the things that people don't realize. That if there's a cough, usually it's viral. And if it's strep throat, usually there's going to be no cough at all, and there's going to be a high fever, and then difficulty swallowing. That usually needs a visit earlier on in the course. Don't wait on that one. Come see us, and we'll take care of that. Or if the cold kind of progresses, and then in day 3, day 4, day 5, there's a fever and an earache, well, maybe it's turning into an ear infection, or maybe a sinus infection. And that's when it would need sort of more of our attention. But in the first couple of days, you can usually just manage it at home for the most part.
Right. How do you know it's a flu?
That's a good question. Flu is a little bit more aggressive. Like the influenza virus is a little bit more damaging on the body. Like I would always tell patients is that it causes every symptom under the sun, and then when you examine it, it usually does nothing. You don't find anything on exam. So you get the muscle aches and the chills, you get the cough, you get low-grade fever, and I always say head to toe, you're experiencing every symptom. It's a little bit more angry as a virus. Do you know what I mean?
Gotcha.
Angry. Good word.
So, and that's something that the flu shot can prevent. So, you know, we do offer the flu shot in the clinic, and I do highly recommend it. It's a good preventative way of avoiding it, possible.
And for all ages?
It starts at 6 months. Anyone over 6 months, all the way through life, can get a flu shot every year.
I've got mine for the first time a couple of years ago, and I'm well, a man of a certain age, so it was time.
Well, there you go. And they ask, actually, does the flu shot make you sick? The flu shot does not make you sick.
It didn't. I know people, allegedly it did, but how much is maybe...
Well, no, what it can do is it could make you get the symptoms of getting sick because it activates your immune system. Okay. So the immune system wakes up and kind of mimics being sick to learn how to fight off the real flu. But there's no live component of the flu vaccine at all. It's completely a dead virus.
And it's different every year, right?
Yeah. What they do is they do some research on other parts of the world because the flu does come in other parts of the world, like Australia first. So they do some research on what strands are more prevalent there. They make some guesses based on last year, and they try to pick the strains that are going to be that they hope are going to be most prevalent that year.
Gotcha.
But it is a very, very educated guess at the end of the day. So that's why some years it hits really well, and some years it doesn't work so well. So, but it's still worth getting it because the risks are very low.
Yeah.
That's good. That's good to know. So over the counter, you can use that for a cold.
Yeah, absolutely. Cough medicine, cold medicine. Make sure you're talking to your pharmacist. They're very good at telling you with high blood pressure, other risk factors, whether you can use it or not. But yeah, it definitely helps manage some of the symptoms. But, tried, tested, and true, just like we learned during COVID, the best way of preventing is hand washing, coughing into teaching the kids to cough into their sleeves, clean surfaces after, somebody's been sick. All the regular ways of preventing the virus are the best way to prevent it passing around the house. Still.
It's common sense.
Well, it's a bit of work, but it works.
But it's... So before we run out of time, we want to take a minute and speak about age-appropriate cancer screening.
Absolutely. Most of the time it's important to check in with your doctor periodically to make sure you're not due for any cancer screening.
Okay.
The first and most important cancer test that we do in the office is PAP tests. It starts the earliest in life. It's currently starting at age 21 for all women, is what's recommended. And then generally every 3 years, considering if the test is normal after that.
Okay.
Also, at age 50 is where a lot of the cancer screening sort of kicks in.
We're going to get back to that. We're going to revisit that again.
Absolutely.
But thank you so much.
No problem.
Georgina, don't go anywhere because we have got so much more on today's Georgina Life.
He won.